The HEAL initiative stands for Health, Equity, Action, and Leadership. It is a global health fellowship program at the University of California in San Francisco, School of Medicine, and in particular in the Department of Medicine. Our mission as HEAL is to train and transform frontline health professionals through building a community dedicated to serving the underserved as their lifelong choice. And importantly here, this mission statement encompasses healthcare professionals of all types, and not just physicians. And because our fellowship is intentionally interprofessional, we have many non-physicians, but who are also working on the front lines in underserved communities. Next slide here shows our core principles. Obviously, we exist to serve the underserved. We believe that having a sustained immersive experience working in the settings where we treat our patients in underserved communities. And so our fellowship intentionally is 2 years long with immersive experiences. And interestingly, those immersive clinical experiences happen outside of UCSF Hospital. Core principle is that we are building a community of practice. The last few fellowship classes have numbered in the dozens, and they are now part of that community practice. And if you join our fellowship, you will join that community practice, not just during your 2 years, but beyond that as well. Also very important is that through our journey, we transform ourselves through active engagement at the personal, social, and systemic level. And I'll get into that in a little bit more detail. Our team is a combination of UCSF faculty, as well as staff, as well as mentors that advise our fellows who are academic faculty, but not necessarily located at UCSF. We have a couple of dozen UCSF faculty involved with HEAL departments, and in fact, also different schools. And beyond that, we have mentors who are at UCLA, in the Harvard system, in Chicago, so all over the country, and also around the world at our partner sites. Our core faculty include Dr. Sriram Shamasundar, who you see here, and also Dr. Robin Tittle and Dr. Ethel Wu, myself as well. And then our core leadership staff include Mr. Joseph Scarpelli, who's the program director, and also Ms. Sangeeta Tripathi, who's our HEAL strategy and operations director. All of us have extensive experience working in global health delivery, and have been part of HEAL from the very beginning. We also have several other staff members who are not pictured here, but who are working both within San Francisco to support HEAL, and also we have staff in Navajo Nation, one of our larger partner sites. Here's a list of our core values. Like we mentioned already, the community of practice. Health equity is our goal, and this idea of context-driven, meaning that there is no cookie-cutter solution, that the solutions in global health delivery have to take into account local context, local history, political economies, and many other factors. And that's the type of approach we take in the fellowship. We focus heavily on equitable partnerships, such that our partner sites have a very, very strong voice at the table. We practice solidarity, advocacy, and deep humility when we go into this work. So the origins of the HEAL initiative and its model stem from this Venn diagram, where we recognized several years ago that we needed to create a global health educational encompasses or addresses three unmet areas of need. One is the unmet need in healthcare in underserved communities at home in the US. The other is the unmet need in underserved communities in low and middle income countries, LMICs. And then the third is that there is a large and growing group of American healthcare professionals about global health delivery, global health equity, and we exist at the intersection of these unmet passions. And so as we talk more about the HEAL Initiative model, this is the key graphic that will allow you to understand why we've developed the model the way it is. Here, I'm sure you have seen maps like this before in terms of the levels of care need for healthcare professionals to serve in communities where poverty and inaccessibility to healthcare is very high. And that includes the US here on the right, where there are many areas with shortages of physicians. And then, of course, on the left is a global map showing just that. For example, in sub-Saharan Africa, they have 2% of the world's healthcare professionals, but yet nearly a third of the global burden of disease. Okay, so what's the fellowship composed of? So the core elements are, we've already mentioned, the immersive experience, serving the underserved. Mentioned this idea of a community of practice, that you're not alone when you're doing global health delivery work, as is often the case. Often people feel quite isolated in their work, the day-to-day work. And so HEAL is a remedy to that isolation. Through the community of practice, you are connected to over a dozen partner sites and many dozens of fellows who are walking the journey with you, and not just fellows, but also staff and faculty of HEAL. We focus heavily on deep mentorship for our fellows, and the mentorship model is kind of like a team-based model where you have a one-point faculty member who is your direct mentor, but you also have advisors who are on site where you're working, whether it's domestically or internationally. And then you have specialty mentors that will be able to assist you should you have a particular interest or need. So for example, if you have interest in ultrasonography, well, we have a point faculty mentor who is specifically on the HEAL faculty for ultrasonography or advocacy or quality improvement or well-being. So those are all HEAL mentors as well and are available to our fellows. We have 3 in-person trainings that we have developed that will take place at the beginning, at the middle, and at the end of your 2-year fellowship. The first training is called GHT, or Global Health Training. It's a 2-week program. The end of the first year, we'll have a 1-week training program called Mid-Fellowship Retreat. And at the very end, you have an additional week of training as graduation. And during those trainings, it's intensive, full-time, and very immersive with workshops and interactive sessions. In addition, we have ongoing professional development and curricula that is online. So for example, we have Journal Club. We are trying to roll out special talks in our sites. For example, in Navajo Nation, we're working to arrange talks that are where our Navajo Nation-based fellows will be invited to hear from a global health expert. But most of the ongoing curricula will be in the online format. Here is another representation of the program components. And here you'll see also that all HEAL fellows who are rotating, i.e. rotating between an underserved community in the US and an underserved community abroad are UCSF clinical fellows. And so we'll therefore get a UCSF clinical fellow salary and benefits as well as professional development support. Here's a rotation model. We have two types of HEAL fellows, and this webinar is really targeted towards the rotating fellow applicant. And rotating fellows have to be either US citizens or green card holders, and have to have completed a residency in the US, so they are either DOs or MDs. And they would be considered rotating HEAL fellows, meaning that they would spend 6 months of the year in a domestic site and 6 months of the year in an international site, and would rotate back and forth for those 2 years. The other type of HEAL fellow is called the site fellow, and these are fellows who are currently working at the site itself, and they could be from any clinical profession, such as nursing or pharmacy or dentistry or medicine, and they join the fellowship as equal HEAL fellows, but yet they don't rotate between a domestic and an international site. They stay at their site where they are employed, but we layer in the curricula, the mentorship, professional development, all on top of that, and they are also equal members in the community of practice. So here's one example of the in-person training. This is a sample calendar of the Global Health Training, the 2 weeks that happens in July. This coming July, the dates are going to be just after Independence Day and for about 20 days or so. See here that the curricula is divided into 6 or 7 different content areas. The yellow is clinical, so you can see that there's 8 hours of point-of-care diagnostic ultrasound that we'll be doing, critical care skills, and then there are leadership sessions that are in the purple, health system sessions are in light blue, advocacy in the teal-colored, ethics in orange, well-being in the brown. And so we have mapped everything to core competency areas, and during your global health training in July, we'll be basically delivering a set of curricula that maps back to each of these core competency areas. Here's some photos of some of these hands-on trainings, whether it's ultrasonography with faculty here, or working in a sim lab. And these are the 6 core competencies that we mentioned. These are competencies that took us over a year to come up with, and are all competencies that we believe are universal for and required for global health delivery experts. And it doesn't actually matter from which clinical background you are from. All of these are required to be expert in global health delivery. Here's an example of some of the advocacy products that have come out from our fellows. So one of our fellows, Dr. Aaron Price in Navajo Nation, wrote an op-ed about the threat of Medicaid, denial of Medicaid expansion on the health of Native Americans, in particular Navajo Nation. And here's Dr. Tim Laux, who is talking about the electronic medical record and the role of global health delivery experts in that. Here are some examples of some of the mentorship sessions during the HEAL Bootcamp or HEAL Global Health Training. And here's a list of the sites that are accepting new fellows for the 2018-2020 class. And these include several sites in Navajo Nation, in New Mexico, and Arizona. These are the red stars here of those sites. And also in Mexico at Compañeros en Salud in Chiapas, in Mali at Project Muso, in Liberia at Last Mile Health, in India, and rural Nepal. Also, there is one that's in Malawi that will also be recruiting. So we would love for you to join us and submit an application on our website. You can go to our website, healinitiative.org, to apply if you're interested. But we are extremely excited to welcome a new class of highly committed and passionate fellows and talented as well. We also would recommend people to apply if they come from disadvantaged backgrounds, because we definitely value that expertise, as well as people from diverse backgrounds. So for qualifications, we mentioned some already. Clearly a commitment, a proven commitment to social justice and health equity. And as I mentioned, US citizenship or permanent resident status. You have to be have completed or be in your final year of an accredited US-based residency program. And these are the specialties that we are recruiting for right now: IM, FM, MedPeds, pediatric psychiatry, OB, anesthesia, or general surgery. And like I mentioned, people who come from disadvantaged backgrounds are especially encouraged to apply. The benefits, these are kind of the particulars here of being a UCSF fellow, include having a standard PGY salary, which is standard throughout the University of California system. 100% benefits, malpractice insurance is provided, travel to and from the sites, as well as evacuation insurance, resources from the UCSF library system, and also support for your housing on the international side. So here's the application process. It's pretty simple. We try to make it as barrier-free as possible. So if you just go to our website, healinitiative.org, you'll click on and read the job descriptions of the positions. Then you'll start the application and have a relatively short personal statement. Put in the names of your references, and one of them must be your residency or program director. And you'll indicate which positions you want to apply for and rank them. And then click on submit by October 1st. And then we will be getting back to you within a few weeks. If you have any questions, the email address is info@healinitiative.org. And we also are on Twitter @HealInitiative. And feel free to send in your questions online, send in your questions via email or via Twitter. And we look forward to hearing from you. Thank you very much for taking time.